I'm Kate Rose. I'm your host today on 21st Century Healthcare Consultants podcast, Home Care Today. I'm really pleased to be able to share our time together with Nancy Fitterer, who is the CEO and president of the Home Care and Hospice Association up in New Jersey. Nancy, it's great to have you with us. I hope that it's not too terribly cold for you way up there.
Thank you for having me. And hey, it's like a balmy 45 degrees, so it's not bad at all compared to the 15-degree weather. So
I tell you what, I think all of us have really had a dose of it this year. I know even down here in Florida, we were below freezing for a couple nights in a row, and Floridians don't know how to handle that as a rule. It's at least the ones that I know. So we're glad for a warm up no matter how we can get it. Nancy, again, thank you so much for being here. I want to spend some time today talking about just letting you sort of give us an overview of some of the current challenges in the home health care industry and hospice industry in New Jersey. What can you tell us about what's going on up there?
sure. So lots of challenges. I think some are particular to home care and then some aren't. We have regulatory challenges, right? There is on both the state level and the federal level. There are regulations that are put in place that we're required to follow, and they can be very challenging to follow. From a funding point of view, our many of my providers take Medicare or Medicaid, and so we're always trying to advocate for higher rates in Medicaid. And then on the Medicare side, every year they try to cut our rates, and then we have to prove that our rates should not be cut. And then I think over all of that, you have to overlay what's happening in the political world right now. With President Trump being inaugurated, that kind of just adds a whole other layer um, of confusion, only because of some of his executive orders stating that funding is going to be frozen, not for Medicaid, although that caused some confusion, but that caused confusion. But like all of the proposed rules and regulations that were kind of going through the pipeline under President Biden are now being paused. And so regardless of your political affiliation, it's more of, okay, well, now what? Like providers were expecting certain things.
Right.
And now they just aren't sure what's going to happen. So I think the uncertainty is scaring some people. And again, there's uncertainty every time there's a political change, whether it be on the national level or even here in the state. But I just think between everything that's kind of happening just on a state level, and then you add that uncertainty, I think it's making our home care providers a bit anxious. And then something that is not particular at all to home care, but just in general, is the staffing shortage. So I am on the phone with a provider, with a department in New Jersey, with our national counterparts, or with just other associations that are having the same issues every day. And we don't have enough caregivers, we don't have enough nurses, we don't have enough aides. How can the association help us gain more staff? So, yeah.
Nancy, what are a couple of the things that you have done that have worked or that are working to help overcome these challenges in the field?
So I think the first one, which you would think would be easy but wasn't, is having the state acknowledge that there was a staffing shortage. It took years for the Department of Health commissioner, and this was during COVID, to actually say out loud that there was a nursing shortage. And you wouldn't think it would have taken that long. So before I started this job, one of my jobs previously was I was the chief of staff for the Division of Consumer Affairs. And that's the licensing body for our nurses and aides. And, we knew, and I worked there in 2010 and 11, we knew back then that there was going to be a nurse shortage and a doctor shortage. We projected it out. We knew it was coming. And we've always known it was coming, but I can't say the state has taken steps to make sure that we stopped it from happening. And so the commissioner finally said out loud, yes, we do have a nursing shortage, which was, again, a positive step. One of the things that they did after our advocating for it, and along with a bunch of other folks, was one of our issues is our nursing schools don't have enough preceptors. So there just wasn't enough people to teach the classes, and because they wanted a decent amount of money to do it because they can get that in the public sector, or in the private sector even. So they raised the amount of money that our preceptors can get. That helped. There's still a wait list for our nursing schools, but that did help. We also advocated for a public awareness campaign. This would be on the home health aid side. So, um, same thing, our Department of Human Services, because they're the ones that regulate home health aides, along with Consumer Affairs, they use some ARPA funds to create a PSA campaign. And I believe the campaign is working because when I spoke to Consumer Affairs, they'd actually said that this was the first year that they were seeing more people apply to be a home health aide than they'd had in the past, which is a great thing. So
That's a good sign.
it's a great sign. What we found, though, is they're applying more to be home health aides, but the amount of home health aides that we currently have stays the same because the people that are currently home health aides have decided they don't want to do it anymore, or they can get paid more to work in retail or wherever else they want to work. So it's a really encouraging sign, and
But there's still going to be that vector between who's actually, you got an attrition rate that you're having to deal with.
Exactly. And, while we love any home health aides we can get, the longer you're a home health aide, just like the longer you're a nurse or a doctor or anything else, you gain more skills. And
Of
so
course.
we don't want to lose those folks that already have skills and know what they're doing. But again, we're happy. I am pursuing legislation that actually gives money for the next 3 years to Human Services so they can continue with the PSA campaign. Because we do know that there's a segment of the population that takes care of their loved ones right now, whether being paid or not.
Right.
And they may not know what it is to be a home health aide. They may realize, like, yes, I'm taking care of a loved one. It's different than taking care of someone you don't know, but we need to get to those people and say, listen, this is what it is to be a home health aide. Why don't you come and learn more about it? So we're missing a whole kind of segment of the population.
How can you reach that segment?
Well, that's actually the problem. So I actually was just in a meeting with one of our senators in New Jersey, and we were talking exactly about that. So in New Jersey, it's called the Personal Preference Program. It's a program that allows family members to take care of loved ones completely outside of an agency. And so one of the things that she had said, and I concurred with, is we need to get to those folks, because when that family member no longer needs help, they may be interested in pursuing that career, but they don't know where to start. And so she had a piece of legislation that she was pursuing that had them be trained as home health aides and to work for an agency. And I said, yes, but we're still missing the piece of having Human Services, which is kind of like their counter, like their appointed person. Tell them about it. Tell them this is what it is to be an aide. And I said that Jobs That Care campaign that they had created, like, send them back to that campaign. That was the whole point. This is what it is to be a home health aide. So, but again, to answer your question, I think the fact that legislators and the state are finally recognizing that there's an issue and are willing to do something about it. That's what I've been pushing for the last 6 years I've worked here. And our legislators, governor's office, and different departments, they are recognizing it, and they are trying to put resources to gain more nurses and aides, which is positive, of course.
It is, and yet you've still got that lag time between the acknowledging that there is an issue and then actually being able to see the issue resolved in real time out in the field. I would imagine there's got to be some tension there for y'all. But I like something that you just were talking about with regard to family members who are caring for loved ones, that they actually, and my husband and I went through this with my dad, as a matter of fact, who at the age of 90 suffered a heart attack, and then for the next 2 years it was hands-on care by the family in order to keep him at home, which is what he wanted. And I think that there's been, it's not my calling personally, but it's certainly what led our family into this industry at large. My husband's very involved with 21st Century Healthcare Consultants, but it's because of our own personal experience. And we didn't realize at the time the knowledge, the skill, the experience that we were gaining, albeit by the seat of our pants sometimes, that can actually be translated into a vocation, a calling, a passion, depending on who you're talking to. But that's a huge wealth of potential help to have, whether it's skilled care, hospice care, companion care, whatever, that people who are coming out of those personal experiences may want to parlay that into something more professional later on down the line.
100%, 100%. Well, same thing. I'm Egyptian. I take care of my dad who has Alzheimer's, and I know many of my friends in our community that take care of their loved ones, but it wouldn't occur to me otherwise. I mean, I'm in the profession, so of course it does for me, but
Right.
otherwise it wouldn't have occurred to me to even go into this profession. And again, you kind of learn by the seat of your pants, right? And
Yep.
and and it's trial by fire, but at the same time, you then find if you have the capacity to do this type of work. And I think it's not just in the Arab community. Another one of my friends is Korean, and she takes care of her mom, and she said, well, in our culture, in our community, we always take care. Like, they don't necessarily ever go into an institutional setting. We always take care of them at home.
Right.
So how are we going into that Korean community and all of those ethnic communities to say, what about being a home health aide? What about even being a nurse for home care? Because what we found is even those folks that want to go into nursing, home care is not what they think of. They think of going into a hospital, going into a facility. My daughter's of college age. She's going to college soon. And when her friends are saying, what they want to do, and some of them say nurses, I said, how about a home care nurse? And they just kind of look at me. And I said, because that's not something that they're necessarily home care when they are in nursing school and they have to go into the community or they have to do rotation. It's not always in home care. And so
Right.
one of the things the association is trying to do is to have nursing schools partner with home care agencies and for them to get a real understanding of what it is to be a home care nurse. And
That seems like a critical piece to the puzzle that you're
yes,
talking about.
yes.
Are there actually processes in place for that to happen?
There is, and I will say some of our agencies have been doing it already, right? Like some of,
Okay.
I have a local community college that's got a really good nursing program. They already work with two of my agencies, but you don't want them to you want them to get a good experience and you want them to see how complex our cases are. And it's funny because I had a meeting with all the deans and of a bunch of different schools, and they said, before the thought was, oh, home care, you're just putting like Band-Aids on, home care, you are
Oh no.
such a sick population. And as the population ages and as more people want to live at home, you are dealing with really, really complex medical conditions. And so I think that's what we need to tell our incoming nurses. Like, if you want to get hands-on experience very quickly, and there's a variety of issues that you will deal with every day, that's when you come to home care. It has its own challenges because nurses tend, the career path or trajectory is usually to go into a hospital. After they don't want to be in a hospital anymore, they may go into home care, they may go into a facility. But in a hospital, you have not only your RN supervisors, you have doctors, you have a lot of different staff that's there. And in home care, you're not alone by any stretch. You can always call, but you're still one-on-one with the patient. And if you're new to being a nurse, then you need extra training to make sure that you can fully handle everything that's going to come at you. And so we definitely take brand new nurses, but again, it just costs a lot more money for us because we need to train them a certain way to make sure they understand. And we even
Right.
had one of my providers hired, a nurse who'd been a nurse in a hospital for 30 years. And she said, I'm done, but I don't want to quit working. I'll give home care a try. She lasted 2 weeks. And she said, there's no crash cart. There's nothing, like, I don't have what she was used to for the last 30 years at her disposal. And she just thought, like, my gosh, I didn't think it was going to be as challenging as it is. So it's a really rewarding job, but it's a challenging job. So again, we're always upskilling our nurses and their training to make sure that they can handle all of the complex needs that are put before them.
Nancy, are there any particular trends that you see shaping the future of home care agencies these days?
I think think utilizing technology, whether, AI is the new buzzword. I was at a conference and everyone was talking about AI, but and AI for sure can transform home care, but I don't even think it's that. I mean, this is new over the last several years, but remote patient monitoring, right? Like you can monitor somebody at home. You can monitor their oxygen. You can monitor their glucose levels. You can monitor their blood pressure. And so you can then identify issues and gaps of care that you wouldn't necessarily be able to identify. You've got the real data and you've got clinicians that are using their software to actually look at real time. And so if a number spikes and it's not supposed to, it's going to alert a clinician. They're going to call you and say, like, listen, hey, how are you feeling? This is what happened. So people want to be taken care of at home. COVID for sure highlighted that, but it's something that we've known
Yeah.
for a really long time. And so if we now have the tools in place that we can monitor people, you are going to be able to give better care to folks. And so that I think is a game changer.
So talking about telemedicine, are you sensing that more people are getting up to speed with that technology and the training necessary? Because that sounds like a huge gap closer as we move into the future. More people are going to be wanting home care, skilled home care, in the comfort and familiar surroundings with their family. If this is going to be an ever-increasing need in this country, and telemedicine becomes a bigger part of that, are there people who are really skilled at training the people in the field to use that technology?
There are. So I have many providers that are using the technology, and then we have something called industry partners. So those are the companies that they offer the software and the actual products. They then train the nurses, and they're the ones that go out. So yeah, I mean,
Okay.
I think it will only become more prevalent, and especially as you see success stories. I was talking to one of those vendors actually this morning, asking him a question, nothing related to anything, but he had said, "Sorry, a person was in the process of having a stroke, and and they caught it, and thank God everything was fine." And I was like, "Oh my goodness!" And he said, "Well, but that's the beauty of the technology, that we have the ability to to sense this. If they weren't being monitored, of course they wouldn't have known until the consequences could have been a lot worse." So
Oh,
yeah,
sure.
I mean, I definitely think the technology is there. I think more and more people are utilizing it, but it's a reimbursement issue, right? Like you can only be reimbursed so much for the technology, and I don't know very much about it, but I know not all of it is reimbursable, and I think it's only reimbursable for some for some providers. So the more we're able to reimburse for it, it obviously has good patient metrics. And again, if you can stop someone from going to the hospital, of course that's going to save money. And then
Always.
even AI, you now have the ability when a nurse is doing an assessment, let's say for a Medicare patient, there's an OASIS form that they have to fill out, and it is an enormous hundreds of questions form. And they go and they meet with the patient and they ask them all these questions. Well, now there's AI technology that just allows you to just speak regularly, ask your normal questions, but then the form is being filled out by the technology. And you still look at it, you make sure it's correct, and then you submit it. But again, trying to make it easier for the nurses, not necessarily less paperwork. I mean, it could be less paperwork, but I think it's more making sure the nurse is paying attention to the patient, because that's what they're supposed to be doing.
Right.
Not worried about, oh, I didn't push this button. It's the patient is in front of me. Let me see how the patient presents and move forward from there.
I would imagine that that's a common experience for a lot of people who are in the field, that they feel overwhelmed, overburdened with the technology side of things, which is why having the training available and having it maybe even being a set apart experience so that it's not incorporated in a bunch of other material and information that somebody's being trained for. It's not an add-on, so to speak, that it's a standalone educational moment for people. Nancy, in the last couple of minutes that we have, I can't believe our time has flown by so quickly, but what would you like to leave our audience with in terms of how to think about approaching this field, this industry? If someone's interested in getting started in a home care agency and they are in the New Jersey area, what would be a piece of advice that you would leave with them?
Well, I think New Jersey is heavily regulated. However, it doesn't mean that we're not a good place to do business. So if you are interested in opening a business, there are definitely more patients than there are nurses, therapists, and aides to take care of them. So in that sense, it's good. And I think for anyone what I think is good about home care is there's a lot of verticals. So if you start out as a home health aide, there's a good chance that they've got a program that could make you an LPN, right? Like they'll help you go to school to be an LPN or to an RN, directly to an RN. And even, we spend a lot of our time talking about how to retain employees, how to make sure they feel valued. And one of the things that we found, and again, this isn't just in home care, is people want to feel like they have the ability to grow in their position. And so I've met many providers that, when they onboard their new employees, the folks that are helping onboard them are employees that had that exact same job and now are in leadership positions. So it's, hey, I came in as a billing specialist, but now I'm in charge of the billing team. Or, hey, I came in as a home health aide. I wasn't really sure what I wanted to do. I like helping people. I may have helped a family member, and now I am an RN. And again, you don't have to become an RN or an LPN. There are plenty of home health aides that want to stay home health aides, or maybe they want to go into the back office and do other things. But I think, what we found, and I talked to a lot of providers, I think when you are giving people options and choices and then training them to the top of their ability, important, because you may have someone who is trained as whatever it is, and they want to continue to learn. We had a discussion with a lot of our home health aides and the state at one point, and they had said that because people are so much sicker, that they always feel like even though they had their training and even though there are in-services that the providers give, they want even more training because they want to make sure that they're taking care of people. And, dementia, Alzheimer's, those cognitive diseases, we take care of a lot of people with those diseases. And so they want to make sure that they have the training that's necessary. If a person has behavioral health issues, they want to make sure there's training that's necessary. So it's really making sure that we are continuously training our folks and figuring out where they want to be and then meeting them there.
And in closing, I think that that's such an important point to leave our audience with, that it's, I used to paint houses for a living. And I used to sit with people as they were trying to pick out the right shade of white or the right shade of gray. And my point to them was always, look, let's paint it. If you don't like it, we can always change the color. Yes, it's going to mean more training, more schooling, more time perhaps, but coming into this industry that we're talking about today, it's not a do or die, never can say never. There's always room to move. There's training available, your organization and other wonderful organizations out there. So if anyone is listening and they would like to get more information, we're going to make sure that we put up the contact points for you folks up in New Jersey. And just for them to know that there's a way in, but once you get in, it's a whole new world to learn about, and find the right fit for you and the right resources and support and encouragement to get you to a future that's going to make a good moment, not just for you, but also the people that you're going to help. Nancy, I can't thank you enough for your time today. There's so much more that I wanted to be able to get into, so I hope that maybe you might consider coming back on in the not too distant future.
Of course. Yeah, it's wonderful. And my closing remarks would be, if anyone's interested in coming into the industry, joining not just my association, but really there's a lot out there. There's so many different regulatory challenges. There's so many things that a provider needs to comply with. So it's really hiring that compliance person, belonging to a federal association, a state association, really, because we're going to be the resources that can kind of help you manage all of the things that you have to comply with.
Well said. Well said. Thank you for wrapping us up. And again, this has been a great podcast with Nancy Fitterer, who has been joining us from Cold Country, New Jersey, as the president and CEO of the Home Care and Hospice Association up there. I'm Kate Rose. I'm your host. Thanks for joining us, and we look forward to seeing you again on Home Care Today.